People ask me, because we go to church, and we're really involved, and we always have been. And in the South, there is a negative stigma around it sometimes. And I think we've had some people say, that that's Satan's weed or whatever. I just think, you know what? Yeah, that's because we've given it to him. And God created it. And here I am trying to take it back and use it for good. It's been used and for bad for so long, and I think that makes Satan happy because he can keep it and he can use it for negative purposes. And the people that are against it are just going to keep it there. But as far as medical use, that's us taking it back for good, for what I feel like God intended it to be used for. He had a normal pregnancy and a normal C-section delivery. Everything was fine. He was completely healthy. And in about 2.5 weeks, he started throwing up. And we went to Northeast Georgia. They took us in an ambulance to Northeast Georgia and did a CT, and he had a bleed, a massive interventricular bleed. He had no trauma. It wasn't any sort of, traumatic brain injury as far as a fall or anything. They believe the clot came first, that he just had a blood clot that just busted a vessel and caused him to seize. So they called Children's Healthcare, and Eggleston sent a helicopter. And they life-flighted him. We found out later that it was one of those things where the helicopter's calling the PICU, the ICU, and saying, we have a baby that probably won't make it to you, but make a room ready just in case. So the bleed was really massive. He was seizing so uncontrollably, they put him in a pentobarbital coma. And the clot started to drain, but then was just too massive. So they put anticoagulants directly into his brain. It was really experimental. And it was one of those choices that we had to make that was either you do this and you might have a chance, or you don't, and he's a vegetable forever, if he makes it. But he made it. We sat and we watched the blood clots drain, and that's all you do when your baby's in a coma. They put him on Topamax, so he was on phenobarbital. He was on Keppra, he was on Neurontin, he was on Topamax, and then Klonopin. Phenobarbital is a barbiturate, but it's what they put little babies on. It's a really old drug that they've seen to work. Keppra has side effects they call Kep rage in the parent community, because the kids just get a terrible raging sort of personality on it a lot of times. Topamax they call Dopamax, because you just feel like you're doped up. A lot of adults take it for migraines, and they just choose not to take it because they feel so confused and just so doped up all the time, like a zombie. Neurontin is for nerve pain, but also helps with seizures sometimes, and that just makes you a zombie. And Klonopin that just knocks you out. I've had adults tell me, they can't take the dose that Hawk was on. And so it was hard because we didn't know what was brain injury and what was medicine. We didn't know, okay, is he brain injured to the point that he's just not gonna move or talk or smile or anything? Or are these the medicines? And so we definitely wanted to get him off all meds we could, not to mention long-term side effects. They're telling me phenobarbital causes long-term side effects of basically all the same stuff brain injury would, just taking away your cognitive ability over time. Well, we don't have any extra to spare, so he can't be on these drugs. I knew that there had to be another alternative. After I started talking to more parents and got involved with Georgia's Hope, a lot of our parents were moving to Colorado, and we considered that as a possible option. I knew that something had to change, and I researched more and talked to more people, I figured out that California was a different option. And so we went to California for 2 weeks. We also did an intensive therapy while we were there. This was August of last year. But when we first got there, we set up an appointment with a doctor and went to go see Dr. Lucido. He's a family practitioner and cannabis doctor. He's been practicing for a long time, since California's been legal. He saw Hawk, saw seizures, and of course recommended that you try Cannabis Oil. It's not a prescription that they give, but a recommendation. Since it's not an FDA-approved drug necessarily, it's not a prescription that you write. It's more like, I would recommend trying fish oil. That would help you. But now with the new Georgia law, he is registered with the public registry through the Department of Health to access cannabis oil legally here in Georgia. But we started on this one. This is Jaden's juice, And this is the one that we bought from Harborside. And it's, oh goodness, you okay? It worked. You know, we loved it. And the each time they do a harvest, you get a little bit of a different mixture. And the first mixture had a lot of CBG, which is what they have kind of studied and think may be good for brain injuries. You got it? So right now we're using this product, a CBD product, in the morning. And we label our syringes day and night, so we're not ever confused. And like I said, it's just 0.75, so it's not even 1 ml. It's just such a microscopic amount. And if he needs more, he needs more. But it's based on weight. And you start at the lowest dose, and you just sort of see what your kid needs. And I always let him smell everything. Even every time he eats any kind of food, it has a little bit of a smell. And so he knows. Bite. You good? Ready? And so the directions, if he could follow directions, would say to let it sit in your, some mucous membranes in there in your capillaries for a while. He does that anyway, so we're good. So there's all kinds of wonderful side effects. You know, they ask you the side effects of cannabis, like they ask you the side effects of pills. Like, well, they're wonderful side effects. There's nothing negative that I can think of. Not only is it helping to control his seizures, but he's brighter. He's laughed for the first time. He's been able to come off other meds, and we've seen his personality shine, and we have just, the same great side effects that all the other kids see too. It's not just talk. And so to see him wake up out of this zombie fog and be aware that you're in the room or I'm in the room. For about 2 weeks now, he's gotten really consistent that when I walk up to him, after I've been, away doing dishes or something, I'll walk up to him and I'll greet him, and he just smiles. He just brightens like a kid should when they see their parent. I've never had that. Yes. Can you look at mommy? Hi. Mwah. And just the fact that I can say, can you look at mommy? And he turns towards me and knows. Like, that's new. He's been laughing for like a month and a half now, and that's it. And I've never had that for 2.5 years. So to see him recognize me and acknowledge me and be bright is something that cannabis has given us that we didn't have before. I love you. Hi. I love you. And he tries to tell me back. Can you believe it?